Can a fatty liver actually cause pain beneath your right ribs? Let's break down what the evidence says and when you should get checked out. Fatty liver disease affects around 1 in 3 adults in the UK. That's a huge number, and yet most people with the condition have absolutely no idea they have it because in the early stages it usually causes no symptoms at all. So let's talk about what's actually going on. Fatty liver disease, also called hepatic steatosis, happens when excess fat builds up inside liver cells. It comes in 2 main forms. There's non-alcoholic fatty liver disease, or NAFLD, which is linked to things like obesity, type 2 diabetes, and metabolic syndrome. And there's alcohol-related fatty liver disease, which develops after prolonged heavy drinking. You might also come across newer terms like MASLD and MASH. These are updated names that broadly correspond to NAFLD and NASH under more recent diagnostic criteria. Now here's something that surprises a lot of people. The liver itself has no pain receptors. That means fat accumulation on its own, what's called simple steatosis, doesn't actually cause pain. The liver can quietly accumulate fat and still function without producing any discomfort whatsoever. So, where does the rib pain come from? If the liver becomes enlarged, it can stretch its outer capsule, a thin layer of tissue surrounding the organ. That stretching is what can produce a sensation beneath the right ribs, but it's important to be clear about what that tends to feel like. It's usually a vague heaviness or fullness, not sharp, not severe. A dull ache, if anything. Sharp or severe rib pain is unlikely to be caused by uncomplicated fatty liver alone. If you're experiencing that kind of pain, it's more likely coming from something else, gallstones, a musculoskeletal issue, or a gastrointestinal condition, for example. Those possibilities are worth discussing with your GP so the right cause can be identified. If you've been diagnosed with fatty liver or you're concerned about your liver health, there are a few things worth raising with your GP or healthcare professional. Ask about your individual risk factors. Things like your weight, blood sugar levels, and alcohol intake all play a role. Your GP can assess your liver health through blood tests, and there are specific scoring tools, including the FIB4 score and the ELF test, that help identify whether any liver scarring may be present. Imaging such as an ultrasound or a FibroScan can also give a clearer picture. These aren't things to self-diagnose, they're conversations to have with a professional who knows your full medical history. Now, when should you seek urgent help? Please don't ignore the following. If you experience severe abdominal or rib pain, jaundice, that's yellowing of the skin or eyes, alongside of fever or chest pain with breathlessness, seek medical attention promptly. Call 999 for chest pain or severe breathlessness, or contact NHS 111 for urgent advice. These symptoms can indicate something more serious that needs assessment straight away. When in doubt, always get checked out. To recap, fatty liver disease is very common in the UK, but it rarely causes significant pain in its early stages. Any discomfort that does occur tends to be mild and dull, not sharp. And if you're experiencing sharp or severe rib pain, speak to your GP to explore other possible causes. Regular monitoring matters, especially if you have known risk factors. This video is for general information only and is not a substitute for advice from your GP or another healthcare professional. If you found this helpful, leave a comment below. We'd love to know what topics you'd like us to cover next. Give this video a like and subscribe to the Bolt channel for more health information. We'll see you in the next one.